Good morning. This information on integrity deals with critical thinking and the nursing process from Chapter 2 of your Fundamentals of Nursing textbook. We went over this information in class, and I want you to review and to answer the critical thinking and other activities in Volume 1 and Volume 2. What is critical thinking? It is a combination of reasoned thinking, openness to alternatives, ability to reflect, and a desire to seek truth. Why is critical thinking important for nurses? Nurses apply knowledge to provide holistic care for the client or patient. Nursing, as you are aware, is an applied discipline. You apply the information that you have knowledge about in the care of your patients. You use the knowledge from other fields such as microbiology, anatomy and physiology, etc. And as a profession, nursing is fast-paced. You need to react quickly based on your client's status. There are different kinds of nursing knowledge, and we talked about each of these. Theoretical knowledge, and you cited in class, and it's as an example, Maslow's and his hierarchy of needs. Practical knowledge, self-knowledge, and ethical knowledge, and examples were given of each. There are 5 major categories of critical thinking. The first one, as discussed, is contextual awareness, inquiry, considering alternatives, and examining assumptions before deciding what assumption is plausible for the situation you're in, and reflecting critically. The definition for nursing process is that it is a systematic problem-solving process that guides all nursing actions. The purpose of the nursing process is to help the nurse provide goal-directed, client-centered care. Phases of the nursing process, according to Wilkinson, 2007, include the first phase of assessment, diagnosis, planning outcomes, planning interventions, implementation, and evaluation. And again, each was discussed in class throughout this PowerPoint presentation. During the assessment phase, which is the first phase, you gather information or data. The second phase involves formulating a diagnosis. You identify the client health needs based on the data gathered. You then plan outcomes, deciding the goals you want to achieve with your nursing activities. And as I stated, the client should ideally be involved in the formulation of goals to help ensure that the client goals and interventions that are formulated to achieve the goals are met. Interventions are planned, designed to achieve the goals, and again, you need to involve the client. Sometimes you may have to involve the family with the goals and the interventions based on the client's status. Choose interventions to help the client achieve stated goals. Implementation is the phase where you carry out or delegate actions you previously planned. Delegation should entail the appropriate activities that can be assigned to personnel. And then evaluation, the final phase. Judge whether your actions have successfully treated, or prevented the client's health problems. How is the nursing process related to critical thinking? Nursing is a problem-solving process that uses many individual critical thinking skills. Remember, the process is cyclical. If you did not achieve one phase of the nursing process, you need to go back and reevaluate. You may have to rechange or reformulate the nursing diagnosis that was made, the goals, the interventions, and then based on the evaluation of the goals and interventions, you determine the need to move forward and determine whether or not the goals were met, or you need to reformulate the process. The full spectrum nursing. I will go over this information. Definition of a full spectrum nursing is that it is a unique blend of thinking, doing, and caring for the purpose of effecting good outcomes from a patient's situation. The concepts of the model include thinking, doing, caring, and the patient's situation. During the thinking phase, you take into consideration theoretical knowledge and critical thinking. The doing phase includes practical knowledge and the nursing process. The caring phase incorporates self-knowledge and ethical knowledge, and the patient's situation includes data collected on the patient and the patient preferences and the context of the situation. You have answered the critical thinking activities and the clicker activities during the last class period. I wanted you to review those and ask yourself, if you were in a situation, how would you best respond if you did not get the answer right, and know the rationale for each.